Good afternoon. This is Elena Tortolot from the Integrated Care Resource Center, or ICRC. Thank you all for joining us today for this technical enrollment call on CMS Historical Part A and B Entitlement Data and the new E&E360 portal. Next slide, please. Michael Katana from InfoCrossing will be our presenter today. Next slide, please. Before we get started, I'd like to quickly go over a few logistics. For those of you joining by phone, you can view the slides with us by logging into Zoom. You can find those directions in the appointment for today's webinar. To eliminate background noise, phone lines are being muted during today's presentation. You can submit questions via Zoom at any point during the webinar by using the Q&A icon at the bottom of your screen. There will be no unmuting of the phone lines at the end of the presentation for Q&A. You can include your email address, and if we don't get a chance to answer your question on today's webinar, we can be in touch with you afterwards. Next slide, please. For today's call, we'll begin by discussing the addition of historical Part A and B entitlement data and review the resulting impacts to the application systems. We'll also introduce updated documentation and outline important implementation timelines. Next, we'll introduce the new Eligibility and Enrollment Portal, or E&E360, and provide a live demonstration showcasing key functionality improvements. I will now turn it over to Michael Katana.
Elena, thank you. Thank you very much. Hello, everyone. This is Michael Katana, and I know I've been working with some of you over the last few years on this Medicare, Medicaid program initiative, and today I would like to, as Elena pointed out, to get started by discussing some recent changes that CMS is making, and I know these changes occur pretty quickly with not a lot of lead time, and as soon as we go over the basics of those changes, I would also like to introduce our new E&E360 portal, which I'm hoping you will all find it to be a lot more user-friendly as compared to the current online processing screen. With that said, let's move on with the recent changes that CMS is going to be implementing. So as you have seen from the documentation that we recently sent out, CMS is adding historical entitlement Part A and Part B data information to the MBD eligibility file that we make available to you within our system. And they also are making this change on the BEQ file response. On our end, we do know that our changes is supposed to occur with our MBD file push on October 1st. As such, and as previously announced to everyone, I want to make sure that everyone understands these changes are going to occur in the next few days on September 29 at 12 a.m. this coming Sunday Pacific Standard Time. We will actually take down our eligibility application 2 hours prior, Saturday evening Pacific Time around 10 o'clock is when we're going to make the change. So for most of you, I want to make sure that unless you use the web service methodology to obtain eligibility information, if you're not ready to absorb this change, there's still some time. But moving on quickly, we'll go over the details very soon. Our MMP Technical Guide version 3.1 document has been released. I'll go over it in a couple of minutes. The actual document could be found at the link that is shown on the ICRC site. Our batch eligibility response that you received, should you be using our Medicare eligibility response on our end, has been changed in similar fashion as to the BEQ response. Our web service SOAP-based process has changed, and I know a couple of the states and their enrollment brokers use the web service. We also are introducing a new RESTful-based web service, which I would like to bring up today. The prospective dual file, which we generate, which I also know some of you do use, has also been updated to include the Part A, Part B prior historical data. And finally, our online standalone screen has been changed to accommodate the new Part AB, as well as the embedded eligibility screen within our E&E360, which we'll touch base on soon. The PCUG has been updated. CMS has generated version 13.2, dated August 30th. There's a link that I'll also show you soon, where CMS has shown they've added the historical entitlement data to the BEQ response. I know several of you do use the BEQ response. At this point in time, I don't know exactly when CMS is going to make the actual change. I'm hoping that very soon an HPMS software change announcement is going to be made to exactly indicate when that change is going to occur for the BEQ response. But do bookmark this September 29th standard date for our changes as far as info crossing is concerned. Also, I would like to bring up the point that this change is not going to affect the enrollment, the Medicare transaction processing at all. We're not introducing new batch error code, so there are no concerns there. So one of the items that obviously some plans or folks might wonder about why this change is primarily it has been instituted for the default enrollment process to help folks pretty much get a good handle on that process. E&E360, the new application, is currently available in production. Any one of you that has a web user ID that currently logs on to our web portal, they should be able to see on the toolbar alongside the online processing, they should be able to see the E&E360 tab, right? So we have introduced this new process not just to replace the online processing with similar feature, but we try to provide additional features, and more importantly, we try to make it more intuitive to use, as well as more user-friendly. All right. So a quick before I go over the various documents and a live preview of the E&E360, I would like to quickly touch base on some of the high-level enhancements that we've made and benefits of using the E&E360 application. It's a single sign-on SSO process. You don't have to go through a second set of user ID like you currently do today with the online processing. So that alone, in my belief, is a positive. It's got a much better look and feel to it. It's a lot easier to use. And we've incorporated a very important feature, and that is the eligibility query function is incorporated inside the system. You don't have to go back and forth between a separate online eligibility screen and go back to your transaction on hand. It's all embedded in there. And more importantly, moving on to the next item on the slide, any data that gets retrieved for the beneficiary at hand is retained by the application and is pre-populated in any of the transaction screens that you're trying to use subsequently to doing a Medicare eligibility function, right? So moving on, quite a few of the data entry functions that are currently redundant in our online processing have been eliminated in the new process. And many of the functions that currently as a user with online processing, you yourself know and remember what to enter have been incorporated into drop-down values, making it much easier for you to select the data criteria you need to use. Okay, a quick follow through with the additional features. Again, a single main page provides access to all the available functions and features, right? On top of the redundant data elimination, we also have assigned to the system all the Medicare contract and PBP information assigned to that contract, pre-made and made it pre-available to you so that, again, you don't need to remember or enter the wrong information. All you have to do is choose the correct contract. And once you choose the correct contract, then accordingly, within that contract, the correct PBP information is displayed for you. Moving on, the CMS TR search function has been incorporated into the main screen for the E&E360. We also have historical transaction processing display for you to show you what transaction was sent to CMS by InfoCrossing on your behalf. So you're able to separately see a CMS TR history screen. You will be able to see a separate transaction history screen, and we're going to also review those transactions. And as there's another section called transaction maintenance, which we'll touch base upon, which will also give you the ability to browse any pending transactions that are waiting to be sent to CMS, which will make it easy for you to select and change and or update or delete as need be as a last-minute option if needed. And then finally, we'll also have a transaction summary that you could pick and choose various dates or the prior default to look at what was sent to CMS, what was received, and whether any of the transactions were matched to the CMS TR response. Okay, so I need to bring up an important point, and that's what I would like to call the transition phase, right? So E&E360 is currently in production, right? So as I said before, it's been already in use by many Medicare Advantage plans, and I also do know that a few MMP MCOs have also started using it. So you guys could start using it anytime alongside the online processing tab. And so that's going to go on from when we introduced the product in production several weeks ago, all the way up to till the end of 2019. So it is important for everyone that currently is using online processing to start using E&E360 as quickly as possible, so that they get used to it and that they realize that by the end of the year, by 12/31, we're going to remove the online processing tab. So starting January 1st, 2020, we will only have E&E360 available. In a few minutes, I'll go over some screens that I would like to provide and share with you. But before I get there, what I would like to share real quickly is a couple of documents with you, going back to the Medicare Entitlement Part A and Part B historical information. Please refer to version 3.1 of our MMP technical guide. It has been published. It has been sent out to all InfoCrossing contacts last week, and it has also been published on the ICRC website. It contains all the specific information you need. As in prior releases, look at the revision history to look at all the details of the changes. It gives you a high-level summary of all the changes. And then as you go down the line, we have a section to let you know about the new RESTful eligibility web service. This is important for us to implement because CMS is also moving on to SOAP RESTful-based API processes in the near future. So everyone has to move on with technology, and we're going to introduce that process, and it's going to be made available also next week. So as always, remember that the help desk is available to help you with any questions, any first level questions. If you don't have a user ID, you would like to obtain one, make sure to contact the help desk. They will set you up both in our QA environment as well as the production environment for the new E&E360. Moving on down the line, we have another key information about the deadline for the September 28th for the production implementation. And then finally, the document also provides you a detailed one-by-one rundown of the changes that we made. In this case, the batch eligibility response, the web service section, the eligibility plus section, Section 8, the prospective dual file process was changed. We have a new Section 11 for the new RESTful-based service. Out of all these changes, if you are not fully ready to absorb, if you're using, for example, the batch response eligibility, there are no worries because the new prior Part A, B dates have been incorporated into a filler portion. So there's no need for you to be concerned with that if you're not ready come this weekend. The only important matter for you to consider if you want to ensure that you have continuity in service is the web service change, right? So the web service is in Section 3 of the document, and come Sunday morning, you need to make sure that you comply with our changes as communicated to you with the WSDL and other pertinent information. So I do know that a couple of you already have been in communication with you. You've successfully completed the changes and you're ready for the web service change. Similarly, with the CMS BEQ process, right? I have a link I'm displaying over here. If you go to the CMS website, look at the CMS BEQ response. I'm displaying over here the response BEQ section where CMS has shown where they're showing the prior entitlement start and end dates. It's they went ahead and used a filler portion of the response file. So if you're not ready to absorb that, you have more time to do it. But as discussed before, we don't know yet exactly at this point in time when CMS is going to make that change. I would like to, before I go on to the demonstration of the E&E360, we do have a user guide, an online E&E360 specific user guide that has been published. This should have been also distributed internally to all InfoCrossing contact members, and it was also published on the ICRC website. Primarily, it gives you a quick rundown of the high-level web portal functions, how to go ahead and set up your user ID and change and reset your passwords. But then as you move going down the line, Section 4 and Section 5 go over the specifics, high-level specifics as what's available on the E&E portal. But my belief is that the system is easy enough and intuitive enough for you to use so that you don't have to use this document, but it's there if you need it. Without any further ado, I'd like to move on to giving you a quick rundown of the application, highlight some of the items that we just discussed. But before I go there, what I would like to do now is to quickly touch base on the current online processing portal that you've been using to highlight the changes, right? So that it will kind of put it in perspective for you to look at the differences, right? So when you log on, as I said earlier, you will always see E&E360 and online processing side by side until the end of the year. After January 1st, online processing will be gone. Earlier, I touched based on the fact that with E&E360, you don't need to go through a second set of user ID. So with the current online processing, you do. So let me quickly touch base on going back here, log on. One of the features that you will soon see with E&E360, as you currently go through online processing, you constantly have to go to different screens. For example, right now, if I want to go to the enrollment screen, I'll have to go past the main menu, click on the enrollment. If I want to go to any of the change functions, I have to do it accordingly. All of that is incorporated in one simple drop-down menu and one plain, simple primary screen for you, right? So that's what I was trying to highlight by showing you the online processing currently. If you want to go inside doing a specific transaction, currently nothing is presented to help you, right? If you want to go ahead and enter eligibility information, you have to go to the eligibility tab, do a separate eligibility, or have a different process available, ensure that you type it in here, right? And then so there's a lot of redundancy there. if you want to know which contract to use, you have to remember it, have it written down and enter it here. Same thing with the PVP information. So all of that is going to be totally drastically changed for you with a new system to help it to help you out in ensuring that you do it quicker and more importantly, or as importantly, with less errors. So I wanted to quickly touch base on that so that you could see the differences, right? So let's move on to looking at the E&E360 function. Okay, so right now I am logged on to our QA environment, right? And that's also, now that I mentioned QA, that's also one additional benefit that I'd like to quickly address. With the online processing, if there were any changes, new transactions, new values that needed to be tested, we did not have a readily available test environment for folks to be able to use it. While we could accommodate it for you, it wasn't readily available. We had to go ahead and customize it for you, which made it a little bit cumbersome and difficult. With the new E&E360, that issue has been addressed. You never have to worry about not being able to do any testing. So if you wanted to go look at any advance notice that we're going to be implementing in production for you on the E&E360, all you have to do is make sure you log on to the base QA, right? The difference between QA and production is the QA. Production is called base.med-adv360, and the QA environment is called base QA. So make sure of that distinction, right? And of course, you will need to call the user help desk to ensure that they set you up a separate user ID for the under the QA environment. So all you have to do is, again, you could go interchangeably, right? Until you get used to it. But all you have to do is click on E&E360. You do not need to enter a second set of user ID, as I said earlier, right? And everything should be displayed to you on a primary main screen, right? One feature that I would like to bring up right now is these three white tabs over here. If you are in any of the transaction history, hit TRC, maintenance, or summary screens, right now the default is the MBD eligibility display. If you want to go ahead and focus on the task at hand, you could click on the three white line. It will get rid of the menu screen and focus, enlarge, and add more fields for you to view on whatever function it is that you're focusing on, right? So if you want to go back to selecting other criteria or using other functions, all you have to do is click on it again. The eligibility tab is at the very top to allow you to pretty much focus. The processing is focused on the eligibility process, right? So if I were to, let me put an example over here. Let me go with a test example that I have. I'll bring it up. All right, so in this case, I have a de-identified fictitious name that I've presented, right? And as you go down the transaction processing, it retains that. But also have to make sure that as you do transaction history maintenance, you got to also make sure that if you want to view additional data that does not pertain to the beneficiary, you got to make sure you do a reset. And I will highlight that as well. One of the items that we've added currently that we're getting ready to implement this Sunday, we have the Medicare entitlement and status, Part A, Part B. We've added the new prior Medicare entitlement, Part A, Part B, right? Incidentally, the same dates also have been added to the eligibility tab that you currently have been using, right? But my take is that if you start using the new E&E360, it really would not make sense for you to continue using the eligibility tab. It's so much easier to remain here and continue working on that. So one of the features I mentioned earlier was that the eligibility tab, the demographic related information is kept. So now that we've done eligibility, if let's say you want to do a TC61 enrollment, right, you will click on the transaction maintenance tab, right? And once you click on that, then the system, the first thing it's going to do is also take a look to see if there's any data available that is pending for submission to CMS. In this case, none is showing because I have this over here. But if I want to maintain that, I'll explain to you soon. Let's say I want to go to TC61, I click on create, right? All the eligibility information that was retrieved from the eligibility database has been pre-populated for you, right? So you could go ahead and as you could see, the last name, the Medicare ID, the gender, the birth date has been put in there. The transaction 61 obviously is a process that that gets grayed out because it doesn't allow you to change it. Earlier I mentioned the limitation that are available with the contract. In this case, we only have one contract loaded into the system for the demo account. In this case, I'm logged on as a fictitious state MMP demo, and my user ID is shown at the top, right? Once the contract is selected, the associated PVPs are also retrieved for you and displayed for you, right? So these are, I believe, major enhancements over the current existing system. The dates, every date-driven function is displayed for you in calendar mode. The old system showed everything in the CMS format submission of CCYYMMDD, which is not user-friendly. This system obviously makes it easier by displaying the data in a format that is user-friendly. So you will put it in a format that makes sense to you. In this case, if I use the effective date of October 1st, all I have to do is select it. No worries with selecting the wrong numeric value, which will error out down the lines. You can only select the correct date. And then these dates, just in case some of you might be wondering, in the background, as we submit these to CMS, we will reformat them to the century year month date format that CMS requires in the March transaction submission. So I just wanted to bring the processing, how much easier it is to use it. I mentioned that you could get rid of the menu screen, and I did just now to make it more convenient to enter for the task at hand, right? The Part C premium amount, you don't need to put in leading zeros. You could put in $12 and the system will adjust it later on. Anything that requires separate values like enrollment source code, it's available for you. All you have to do is pick the right one. So I wanted to highlight this to show you the differences and what I believe are quite some nice improvements over the old process. So if you want to go ahead and display some data on the transaction maintenance that your entire organization has been processing and working on, you need to make sure you reset the lookup for that. Go back to transaction maintenance. Right? In this case, we simulated some processing earlier today. We, for example, in this case, we're showing 72 transaction, 51, 61, ready to be sent to CMS. Incidentally, just so that you know, the system does not only show you what's been entered and processed via the online screen. The updated by will show you the web user ID, but you will see the batch or the batch program ID there, which will also show you anything that your automated FTP processes have also sent and are ready to go to CMS, right? So this will give you the functionality of viewing what's available, which wasn't readily available before. You would have to go to a different screen. You'd have to go through file transfer. You'll have to request a submission for a special extract. So this streamlines it for you a little bit. And then incidentally, if let's say you're doing last minute work and you want to actually make a change, all you have to do is click on the selected record. It will allow you to change it. Any function that is allowed for edit will open up and allow you to change it. It will allow you to validate it, resubmit it, or if you choose, you could delete it. Okay, so we talked about the MBD eligibility information. We talked about the the process is available to you to do a transaction maintenance submission. Instead of like the online processing, instead of going to a multitude of different screens, all you have to do is come here and select the transaction you need to do. Everything is available in that primary menu screen, right? If you want to look at historical transaction submission to CMS, right? All you have to do is click on transaction history, and it will by default display to you. It does it in chunks of up to 2 weeks time frame to allow for performance consideration and display on the screen. Plus, it doesn't make sense to display pages upon pages of data on the screen. So the default is 2 weeks prior. You could select the date menu. You could go back for as far as you wish to, or as however long as you want. For if we have data going back to 2013, then we'll display it. The only limitation is it will be in a span of 2 weeks, right? So keep that in mind, and then you could further fine-tune it by Medicare ID, which is currently comprised of either MBI or, as you know, HIC numbers, and hopefully by the end of this year, we'll have more confirmation from CMS that as of January 1st, it will only be comprised of MBIs going forward. You could use the search function to isolate. If you're looking, for example, for a specific MBI, you could enter it here. If you're looking for a specific transaction type code, you could enter it here. It will focus only on the transaction, right? So you could choose, or you could go by last updated. So whatever function you want to search it by, you could choose that route and limit it and help you identify what you're looking for. The same process exists for the transaction history, right? So the difference between transaction history and TRC history and transaction history is the TRC history focuses on the CMS TRs, right? So the same search functions exist for you. At the bottom will show you how many pages we have available for the 2 week time frame. You could jump to the first page. You could also do a search. Same processes are available there for you. So keep that in mind as you go along these features, and it will allow you to zoom in on any specific transaction that you're looking for. We talked about the transaction maintenance. If I go back in here, again, I like to make sure you remember to focus on whether you have anything highlighted there, anything retrieved from there or not. If you actually had done a MBD eligibility query, you're not going to be able to see anything that is currently waiting to be sent to CMS. Lastly, we have a transaction summary tab. The transaction summary tab allows you to get a preview of what was recently submitted as a default to CMS, or you could also go ahead and go back in history, right? You have a two level. You have user level, you have organization level. User level is restricted to you as a user. It looks at your logon ID. If you're interested to only see what you as a user process, you could choose that, or you could go at the organization level. Before I quickly show you an example of some data we loaded, I'd like to get your attention on the submission times over here, right? To show you that we submit transactions to CMS 3 times daily, unless it's customized differently. For whatever reason, CMS does encourage everyone to submit data to CMS as often as possible to optimize compliance. We also have a note about the CMS TR responses. So when you look at the 7 a.m., 4 p.m., 8 p.m. time frame, Pacific Daylight Time, keep that in mind. Come to think of it, we should have also put that under the transaction maintenance, because right now it's 11:40 a.m. Pacific time, so it's 2:40 p.m. Eastern time. So in a few hours, all of these transactions are going to be swept and removed from here. So as you start working with the screens and get familiar yourself, and then try to supplement these screens with your automated processes, right? For example, this morning there was concern as to why some TLRs are not received. So you could start using the screens to do some investigation, find out what's going on, to help discern and find the issue at hand. So as you get started working on these screens, keep in mind the submission process, because in the real production environment, these at 4 p.m., subsequent to 4 p.m. will disappear because they would have been sent to CMS. Going back to the transaction summary, if you go by organization, in this case, I believe September 16th was when we created some test data. It was, let's see here, organization, no, September 16th. 16, yes, let's try that. There you go, yeah. So we created some sample test data that we submitted to CMS on an ongoing basis. As we submit to CMS, you will be able to see how many transactions were sent. We'll look at the prior days, calendar date. We tabulate all the records for all your plans. We'll show the display what was sent. We will break down between accepted, rejected, what was received from CMS, and whether we have not received any CMS responses, right? We have it in the pie chart format over here. You could click on that to look at the displays, right? In this case, those to get a quick feel. And obviously, all of these functionalities are still available to you in our normal portal, right? So if you were to come back to the main screen, the file transfer, eligibility, many of these functions are also available in these screens. So you could use them interchangeably, and as you become more comfortable with it, then you could continue focusing on using E&E360 in a better way. So I'm excited about this product. I think it's going to be providing a lot of benefit to a lot of users that could start using it. We have, alongside the MMP program, also some Medicare Advantage plan sponsors that use it. We have received a lot of feedback, and we're gonna be doing probably quarterly phased improvements and additions. Look forward to seeing some additional enhancements next year. We're gonna be incorporating also some of the batch processes that we currently do behind the scenes, which are not so much visible. We're going to incorporate those with the E&E360 tab, so we're going to have additional functionalities available for you to work on the batch process as well. We're also going to have, alongside the member tab, we're going to have a new tab called reports. What the reports will do, and that will again be available next year, will give you a host of additional reporting capabilities on top of what we have today. So we already are working on those, and we are validating in our QA environment, and we're hoping to introduce those very shortly. So look forward to receiving some feedback on that in the near future, after most likely after annual enrollment period ends, most likely January, February of next year. And those reports are going to be their business analytics, right? You'll be able to yourself as a user do some customization as far as what you want. But we're going to have a lot of very important reports which we have completed and will make available to you, such as we're going to focus on avoidable rejects, right? Allow you to go by the prior day, prior week, prior month, tailor it the way you want, to look at how you're doing with CMS, how many avoidable rejects are you getting, where are the issues, the problem areas, focus on which avoidable rejects is very common, so that you would know where you need to focus on bringing your attention to correct that area. Another report will be how often, how quickly you process your enrollments. Those are the two that I like to talk about right now. Let you know, get a feel for what's coming up. The enrollments will be how quickly you process to CMS. Are they within the 7-day compliance time, right? CMS does require Medicare Advantage, including MMPs, to process and submit to CMS requested enrollments as quickly as possible within 7 days of application receipt, and one of the reports will focus on that. So thank you for allowing us to showcase the availability of the E&E360, and I would like to go ahead and start going over some. I believe we're done with the display, and I'm hoping that all of you will start using it if you haven't done already, and definitely come back to us with feedback and responses. The help desk, as you all know, and hopefully have been using, is available and ready to take any feedbacks that you have, any issues that you have with E&E360. We're calling it beta phase right now because we're taking validation and feedback and anything that you might suggest for us to improve. For example, on the TRC history tab, transaction history tab, we're making changes to make it more performance oriented at this time, and we welcome any additional feedback that you may have. So, Alina, I think we're ready, hopefully, to address any questions that anyone might have.
Yep, so I'd like to invite any questions that anyone has. Feel free to share your thoughts through the Q&A feature. And it does look like we have several questions for you, Michael. So the first is, for the historical entitlement data, it looks like multiple fields have been added to the CMS BEQ batch response file. Our organization receives these files from InfoCrossing, and we're wondering if the format for these files is changing and how that might impact us. Do we need to make a change to our application system which reads this file to account for those additional fields?
Yeah, thanks, Alina. Yeah, as we talked before, that's a good question, and it's a big worry. It has to do again with how quickly this came about, right? The change by CMS was literally announced a few weeks ago, so we scrambled making this change. The batch responses that you use is not going to be affected if you're not ready. Same thing with the BEQ. As I have shown, the BEQ response, when CMS will actually populate it, you don't need to worry about it impacting your system because the record layouts haven't changed. Now, with that said, the web service function that we have, as described in Section 3, if you are using that, you got to make sure that you are ready for the change to accommodate the new fields, or else your process is going to fail come Monday. If you do have problems with that, definitely do contact our help desk. We'll see what we could do to help you with that. That's a good question. Great.
So next question, why is CMS adding the historical fields to the eligibility process? Do we have to comply?
The entitlement date has been primarily pushed over by the MMCO so that to facilitate with the default enrollment process, right? So that's important data. It will definitely help you in that regard. Whether you have to comply or not, internally, along with the rest of the Medicare Advantage community, they could go ahead and evaluate those fields and determine from their business perspective what use those fields will have separately from the default enrollment process. So it's something that you could determine, but for the default enrollment process, it will certainly have value for you. For compliance and from a legal matter, obviously, and also as you start using or are using the PDF file, the prospective dual file, these fields are also added there, so that you make a note of it, and it will also help you for you to determining the default enrollment process prospectively. You will have value there. Good question, also.
Great. And then for our next question, can multiple transactions be done on the same day for one member? So for example, if they're being disenrolled from one plan and enrolling into another.
Yeah, whether that question is specific to E&E360 or not, it's valid right now without E&E360. It all depends what is being done, and also just so that that brings up another good point for us to share at this point. E&E360 is a new online UI portal, right? The entire background behind it, the database process system hasn't changed, right? So in other words, the batch enrollment, the online processing, the database environment, E&E360 shares all that. So I want to make sure that everyone understands that there is no new database behind it. It's just a new enhanced user interface and to facilitate the processing there. Going back to that question, yes, it can be, but it all depends on exactly what is being done. Obviously, some transactions must be processed, in sequence, right? Enrollments before these enrollments. We do apply some edits against the CMS TRRs, right? In terms of cancellation. If you do a 61 enrollment today and it's sent, but CMS TR is not received, you cannot do a cancellation right away. We'll reject because we're going to let you know that we haven't yet received a 61 enrollment confirmation for you to do a cancellation. So while it can be done, you have to do it cautiously.
Great. And then just a couple more questions. So you mentioned that these entitlement historical updates are occurring in production in a few days. What if we are not ready for the changes?
Yeah, this touches base some of the other questions and also what we talked about. If you're not ready, it's fine. You could, the enrollment process, the batch process, nothing has changed there. There'll be no failures, no processes on your end. And just so that, also just because we're also making the change on the weekend, we still have to wait for CMS to provide us the values for the prior Part A, B, with the October 1st file push from CMS. The expectation is that it's going to happen on October 1st. But as we've done changes in the past, recently in the last 2 years, the ineligibility information or the incarceration portion information, while the record format changes were made, we have not yet received data from CMS. So the same thing could apply over here. But again, to touch base upon the question again, there's no harm done. Everything will be fine. If you use the MVD eligibility response, you'll be fine. Same thing with the BEQ response, you'll be fine. The only impact will be the web service eligibility.
Great. And then our final question for today, would you be able to provide training on the new transaction processing screen?
Yes, the training is, we actually are doing demos and training for many organizations separate from the MMP program. All you have to do is contact the user help desk, right? And provide a date, time, and we'll do a more detailed dive in with some demo region that we have set up just for that purpose. So I'll participate as well, along with some of our business analysts that will be helping us in this process. All you have to do is give us a call and we'll be more than happy to assist you.
Great, thank you, Michael. So that concludes our questions for today's webinar. Thanks again to Michael for presenting and for our partners at CMS, and to all of you for joining us today. Please visit the ICRC website listed for a copy of today's slide deck along with the recording. You can also find links to past study hall calls, webinars, and briefs. And as Michael mentioned, if you have questions about today's webinar, you can use the contact information provided on slide 12 to contact InfoCrossing. For questions about ICRC projects and support, please email icrc@chcf.org. We hope this has been valuable for you all today, and thank you very much.
Thank you all. Have a good day.